All right. Hello, everyone, and welcome to our March Women's History Month event. This is called Rising Together, How Mentorship Can Elevate Women in Physical Therapy. This is a virtual event really to celebrate not only the contributions of women in physical therapy, but also to highlight the importance of mentorship within our profession. Mentorship can create an environment where women can uplift others, provide a safe space where you can lean on someone else when you're either starting early in your career as a student or even as you're progressing and wanting to change paths or just seek guidance in certain areas of someone that might have walked that path before you. As we start our presentation, we just ask that you remain muted throughout while the speakers are going. If you have any questions that come up, please utilize the chat box. We'll be having a question for or a portion for questions at the end, and we'll make sure to address as many as we can as long as time permits. If anything comes up before then, please just let us know and we'll make sure to address it in a moment. This is supposed to be an engaging and exciting event, and I'm really looking forward to it. So if everyone's ready, we can get things kicked off. All right, so this is the event outline. So first we're going to start with who we are and why we're putting on this event as the APTA VAD&I committee. We're going to test your knowledge with a little bit of interactive trivia. We're going to explore what it means to be a mentor. We're going to be able to hear from you, but also we'll fill any gaps in areas that we feel might have been missed. We're going to talk about the makings of a mentee. At times there are mentees are wondering, okay, what is my role? How do I perform as a mentee? Where do I fit into the puzzle? And what are my specific tasks that I need to do? And we want to provide those watching or present here today with any tips that they can use to move forward. We're going to have the highlight of tonight, which is our Women's History Month highlight. We're going to have Dr. Rebecca Griffith speak about her personal experiences throughout her career. We'll listen to her journey as a physical therapist and how she's gotten to the point where she is now. And then on the flip side of that, we're going to explore the dynamics of a mentor-mentee with Dr. Anna and also Dr. Julie. At the end of that, we're going to talk about resources that you can use as both a mentor and a mentee, and then we'll open the floor for questions. So we are the ABCA Diversity and Inclusion Committee. So our mission is to create a community through events and education that promotes inclusion, equity, awareness, and understanding. Events like this that we're having tonight and events like the ones we've had in the past. This is really to impact the physical therapy profession in the state of Virginia by driving initiatives that focus on positive change and action items to elevate consciousness and inspire clinicians to do the same in their respective communities. So tonight there'll be a call to action. We're going to be asking you to be that great mentor, be that great mentee. And again, the purpose is really to support the efforts of DIS. VPTA leadership will increase representation and awareness throughout the Commonwealth by creating a mentorship program, which we have done, attending job fairs, visiting schools, church events to promote the profession, getting the word out, making sure that the first time people encounter physical therapy isn't during an injury, which is probably not the best time for them to come into our profession, recruiting with the assistance of district directors, and then also utilizing our communications committee to promote the efforts and needs. And this event tonight is important because mentorship has shown to be a crucial factor in career development and advancement, especially for women. But women in physical therapy are reporting having fewer mentors than their male counterparts. And the ABTA actually did a survey, and 72% of male PTs have had a formal mentor compared to the 64% of the female PTs that say they've had a formal mentor. So there's a little bit of disparity there. And there's also another study that found that women in physical therapy are actually less likely to have a mentor who is a senior faculty member or a department chair, which also might hinder their career advancement or seeing themselves in that role, which make them feel like it's not attainable. So that is why, again, we're stressing the importance of mentorships on all levels, like not just lateral, but upwards, right? So again, the lack of mentorship in women physical therapy may contribute to that gender pay gap. So in the field, it's saying that the median annual wage for physical therapists for men was 91,000, and then for women it was 84,000. So again, we have that disparity, and then we can pose a question: is it because of the lack of mentorship? Is there's a gap there? Can we fill that? So tonight we're hoping to discuss that, talk to people who are doing it, have experienced it, what it looks like on both sides of the coin, and hopefully this inspires you to go out and make a change within your own community and within even smaller, like your clinic or anywhere else, any school that you're associated with or anything else moving forward. And we'll keep things moving. So who we are, this is the Cultural Humility Committee of the ABCA Virginia Diversity and Inclusion Council. So you have the chair, Blake Banner, that's me. We have all of our amazing members. We have Lynette and Anna, who you'll hear from later, and then Jessica as well. So now we're gonna get you involved. So we're gonna do a little bit of trivia, and I'm gonna pass the mic over to Lynette so she can take over for testing your knowledge.
Yes, so this is a Kahoot. So those who are on this call need to get their phones out so you can play along, just so that you're aware, since we had a little bit of a snafu. But I'm going to change my screen a bit here and pull up the Kahoot. So if you can scan, and or if you have the app, you can go on the app, or you can go to the website itself that's up there, and then put in the game pin that is on there, the 408549, and enter the screen. That's good. Good. All right. So from here, we're going to start. I think most of us are on there. So let's get started with the first question. Where did the word mentor originate? So put your answer in. Greek mythology. Very nice. All right, so most of us got that right. Very good. Let's go to the next question. Oh, who's on top? Looks like Rebecca's on top. Nice job, Rebecca. Next question. Blank make up the majority of physical therapists, and blank make up the majority of leadership positions. Women and women, men and men, women and men, or men and women. Very good. Yes. Women make up the majority of physical therapists, yet men make up the majority of leadership positions. All right, next question. Oh, who's on top? Rebecca's still up on top. Good job, Rebecca. You're quick. All right, according to the US Census Bureau, the gender pay gap between females and males has narrowed by blank cents since 2011. 25 cents, 15 cents, 5 cents, or 10 cents. 15 cents. Very good. Who's up on top? It's still Rebecca. You're doing great.
A minute to win it. A minute to win it.
Clearly you are. Very good. Victor went up though. All right, true or false? Mentorship is primarily to help mentees develop. False. That is false.
So it's false because it helps both mentors and mentees. So it's important for both parties to identify their goals, expectations, and communication discrepancies between them for long-lasting and sustainable mentoring relationships.
Yes, very good. And look, Victor's up on top now. Nice, Becca, you better get in there again. All right. Which of the following should a mentor not do? provide timely constructive feedback, set expectations and goals, instruct on what the mentee should do, problem solve with mentees through challenging experiences. Instruct on what the mentor should do. Very good. All right, let's see who's up on top now. Rebecca's back up on top. Good job.
So the reason that we shouldn't instruct on what mentees should do is because the goal is for them to promote independence, and it's more about problem solving with them rather than telling them exactly what to do.
Very nice. Good. All right, question 6. When is National Mentorship Month? March, May, September, or January? It is January. You would think it's March since we're having this in March, but it's not. It's in January. Good job. Who's up on top? Victor is up on top again. You're close, Rebecca. You better you gotta go faster, maybe. What percentage of mentees later go on to become mentors themselves? 89%, 54%, 31%, or 72%? 89% go on to become mentors themselves. Good. Who's up on top? Did it change? It didn't even change. Everyone stayed in the same place. All right, Victor, you're still up on top. Last question. When beginning a relationship, how often should mentors and mentees meet? Daily, weekly, monthly, annually. This is at the beginning of a relationship. So the answer is weekly.
So daily could also be good, but it's been found that a lot of people might find that very demanding. So at least weekly for the first 6 months, and then it can progress to less frequently once the relationship is established.
Yes. All right. So who's up on top? Third place. Oh, third place was me. I didn't put a nickname in. Second place was Rebecca, and first place, Victor. Victor's up on top. Nice job, Victor. All right. We're gonna close that out. Good job on that. And we'll go back to our slideshow. Thank you for participating.
Good job, everyone. Hopefully everyone is
Yay.
stepping away, learning something new, in case you're in the back of a cash cab, the origin of the word mentor, right? It's Greek mythology, right?
That's right. And that mentor month is in January.
There you go. You never
That's
know. It could get you extra $500 in the back of a random cab, or if you're
That's
on
right.
Jeopardy one day.
Exactly.
So we're going to Oh, yeah, go ahead, Lynette. You got it.
Okay, so now we're going on to exploring what it means to be a mentor. These are supposed to be Wordle or word cloud. So please, if you guys who are on here can scan that QR code. We love our QR codes. And then type in words. And as you type in words, it will show up on the screen in a word cloud of what it means to be a mentor. Nice. I like the words that are coming up here. Guide is big on there. Seems like a lot of people are putting guide. Coach, colleague, patience. Yes, patience is necessary. Advocate, that is good. Listener, yes. Helper, absolutely. Supporter, I love supporter. Opportunity developer. Yes, I love that. Advocate. Technically came up twice. It put an advocate as 2 words. That's funny. Giver. Good. Mirror. Ooh, I like that word a lot. Challenger. Network access. Yes. Empower. Good. Yes. Very nice. Promoter of the profession. Absolutely. Good. All right. Maybe we stop there. Does anyone want to say anything regarding their the words that they put in? Why did you put those words in there? What does it mean to you?
I know I added advocate just because, especially for new clinicians, when you're coming into the field, having somebody who is more seasoned or vetted be able to speak on your behalf as what they've seen, because sometimes as a mentor you have more one-on-one time with that individual, so you see things that maybe higher level like executives or even like managers or directors aren't able to see, so they can speak on your behalf. So I feel like that is extremely valuable, especially early on in your career when you haven't had the chance to quote unquote prove yourself, and to see how you are able to operate. So I think advocate is huge.
Good. I agree. I really like opportunity developer. I know in the past that I had a mentor that I didn't even know was a mentor until later on in my career. And it was because they kept putting forth these opportunities for me because they thought that I could do it when I would have never done that myself. But they showed me what I could do, and I thought that was invaluable. So I really like whoever put in opportunity developer. All right, thanks. So I'm going to go on to the next one, which is what are the benefits of being a mentor? So again, put in words. It'll show up as a little bit of a word cloud as you put your words in. Nice. So be the person. Oh, I like that. Be the person you wish you had early on. Can't read it all because I have a little thing that's popping up. Ability to learn from the mentee. Good. Learn. Lots of learning. Communication skills. Yes. Self-reflection. Good. Staying sharp. Absolutely. And growth. Yes. More network expansion. True. Stay up to date on new practices. Learn from the mentee. Lots of learning. I agree. I think learning is probably a big one. Stay up to date on new practices, new challenges. Yes, remember your own journey. It's true. Sometimes we forget things and then we see people doing it going, oh, I remember doing that. Yes. Very good. Thinking of your goals. Ooh, I like that one a lot. They do. We really do have to think about our own goals while we're working with our mentees. Good. Network expansion, partnership. Ooh, I like partnership. Good. I think a benefit that's not on here is maybe even friendship. I feel like sometimes our mentees really become great friends too. All right. So this is just what we had put down. I think that a lot of these you guys have already answered, but career development, so helping to develop careers, can help women in healthcare. So speaking specifically to women, it can help women in healthcare navigate those challenges in their profession, develop the skills and knowledge necessary, maybe even give them the confidence. That's not on there, but I think that it could do that. Mentors can provide guidance, feedback, and support that can help mentees achieve their professional goals. Absolutely. Networking, you guys talked about lots of networking that can be provided through being a mentor. Role modeling, yep, you guys talked about that. Building confidence, develop leadership skills, inspire others to take on new challenges. You guys talked about that. Work-life balance. Women in healthcare often struggle to balance their professional and personal lives. Sometimes it's nice to have that person to talk to about that and guide them through that too. Mentors can provide strategies for managing that stress, building resilience, maintaining a healthy work-life balance. Good. Very nice. Diversity and inclusion is also something that can come from being a mentor in healthcare, especially for women, by encouraging them from underrepresented groups to enter and succeed in the field. Absolutely. I feel like as women, we bring forth a lot of different opportunities for other women to grow as a person, but then also include them in from underrepresented groups. So yes, absolutely. All right, there's one more thing that we're going to talk about before we get to our guest lectures. You can tell that I'm in education, but our guest speakers, but the makings of a mentee. So the next question is again another Slido, but this one will come up more as sentences. So if you can scan your QR code, or it might just come up. What are desired qualities of a mentee? So thinking more on that from the mentor side, or even from a mentee side, what do you think are qualities that are necessary to be a good mentee? Adaptable, good. Teachable, commitment, willingness to learn, yes. Patience, willingness to learn. Yep. Open-minded, I like that. Lots of patience. Patience keeps coming up, good. Willingness to learn and patience seems to be big ones. Excitement about the field, good. Honest and ready, yeah. Flexible, that's a big one. I would agree with flexible, absolutely. Good. Sponge, empathetic. Yes, empathetic. Putting pride to the side. Oh, I like that one a lot. That one's hard, teaching them how to be vulnerable, maybe, and a little bit humbled along the way for some. And yet pull others up, I think, giving them some confidence, being confident, more confident. Contributor, good. Yes, and when you say, I don't know who put contributor in, can you explain that one a little bit from the perspective you were taking that from?
So I put that one in because I think that, like we were talking about, that the mentor and the mentee should contribute to one another. So just going into that relationship, knowing that you also have something to contribute and that it's not a one-way relationship.
Yes, I like that. Yes, it is not a one-way relationship. And I will say, I feel most mentors expect that you are contributing, and it's really hard to keep that relationship going if you're not contributing. So absolutely. And growth mindset. Oh, I like that a lot. Good. All right. So these are just some of the things. I think you guys got most of these. But this is just stuff that we found along the way in the literature. But be open and willing to learn, set clear goals. Oh, that one didn't really get mentioned a whole lot, but yeah, what are the goals of the mentee? Making sure that as a mentor, you know the mentee's goals, and as a mentee that you have some goals that you can communicate to the mentor. Communicate effectively, follow through with commitments. That's a big one. So I don't know of any mentor and or mentee that really doesn't care for people to follow through with their commitments. So just make sure to follow through with your commitments. Be respectful of your mentor's time. Everybody gets busy. The mentee is busy, the mentor is busy, and I think that goes both ways with regards to being respectful and just showing gratitude. Absolutely. Great job to everybody that participated. And I think it's time to go on to our highlight, who is Dr. Rebecca Griffiths. And I'm going to have Blake go ahead and introduce Dr. Griffiths, if that's okay.
Yeah, absolutely. So this is really our Women's History highlight. We're getting into really the meat of tonight, where we're showcasing and highlighting the women, the mentors, the mentees, everyone who has lived it, experienced it, and have something to share and have a story to tell, right? So Dr. Rebecca Griffith, I was able to reach out directly because this is someone who I've seen that is so active and is moving and shaking in APTA as a whole, but also within her field and exploring and expanding within physical therapy within the emergency department. You see the bio, PT, DPT, NCS, specializing in emergency department and ICU settings, believing that physical therapy should not be a luxury and should be accessible to everyone. Absolutely, particularly in life's critical moments, that emergency medicine being that at the forefront. The founder of ED-DPT, a business that's focused on making emergency physical therapist practice well-known and well-practiced. I'm sure like when I was in school, that's something that I was not exposed to. And even when I was in that acute setting, going into the ED was completely overwhelming. There's so much going on all the time. So definitely seeking that guidance. I probably be reaching out again in the future to for some assistance, mentorship maybe. But again, serving as the APTA Colorado Chief Delegate and believing in work-life flow, not just balance, we're flowing, right? We're doing it all at once. We're not tipping a scale. We're doing all things at the same time. So as I pass the mic, I'm going to just ask that Dr. Griffith, just start by sharing your personal story, share with us a little bit more in depth related to the bio. And then from there, you can just straight go into your experience with mentorship and how it played a role, or maybe the lack thereof led to you doing what you're doing now. So I'm passing the mic to you. And after you finish, I'll be just asking a couple questions to follow up.
Well, thank you so much for having me. I really appreciate it. I'm Rebecca Griffith, and I'm a physical therapist here in Colorado. And I've had a really interesting journey to get from where I started to where I am now. I never thought I'd be a physical therapist. I was going to be a lawyer, like in a John Grisham book. And, during when 9/11 happened, I was actually working in finance at Merrill Lynch. Like then I was going to be a stockbroker. I was going to do all these different things. But then it really was my time to like step back and think about what I wanted. And part of what I wanted was to become a person who helped people live the life that they wanted to live. And I didn't want to be strapped to a desk, and I wanted to help bring people hope. So one of the things that I say the most about being a physical therapist is that we're hope bringers, and we really are the people that help those people take their first steps and help get their life back, which I think is unique in the medical field. And I think we're lucky to be able to do what we do. So that being said, like I started my career in brain and spinal cord injury rehab at Craig Hospital, thought I would do that for the rest of my career. Then I had kids. And so when we talk about like the bio and how that affects your career, I'm a huge believer in life work flow and not work-life balance. So when we talk about work-life balance, I hate that work is in the front and life is at the back. And I hate this unrealistic expectation that we're supposed to balance both of those things. And particularly for women, one of the things that's often said is that you should work like you don't have children and mother like you don't have a job. And so I find that to be really a difficult thing to reconcile. So as I was looking at that, like, how do I live the life I want as a woman? How do I raise the family the way that I want to do that? Because that's my biggest priority, but also not have a small career. How do I make that work? So I tried lots of different things because our profession can be flexible that way. I tried per diem in the orthopedic setting, and then I was invited into acute care, because that is a pretty flexible position for working women. You can work per diem, you can work weekends, you can work kind of different shifts. You can have a little bit more flexibility. So I never thought that that would be an area I would work in. But once I kind of tried it and realized that there was so much opportunity there and so many ways we could impact our patients, and I was also able to leave my work at work and then come home and be present for my family, because I didn't get overly involved in my patients' lives. I maybe saw them once or twice. I never had like these very long, complicated relationships. And so I could really close the door at work and then open the door at home without having a lot of crossover, which worked very well for me. And then kind of as part of that, I ended up in the emergency department, which is one of the areas I feel like we can make the biggest difference for patients who are having some of the worst moments of their lives. And if you think about it, if your family member had low back pain, would you want them to go to the emergency department and see a physical therapist? Or would you want them to see a physician who is also trying to deal with several other different emergencies at the same time? We want to make sure that people are getting that best care that they can when we're the right provider for that job. So I hope that answers that question a little bit about who I am and how I got to where I am. And just to kick off with what you said about mentorship, when I started my career, I think I was so desperate for mentorship and I didn't know how to find it, that I was like a little plant in the desert that was just desperate. And I would take any input from anyone who would pay me any attention. And I think the problem with that was I wasn't focused. I didn't know what I wanted. I just listened to people who were telling me things that sounded good, people that I respected, but they weren't necessarily relationships that were focused on any specific goals or to push me in any particular direction. And what I've learned about mentorship since then is that it does need to be focused. It needs to be with somebody who can see you. It needs to be with someone who knows which way you want to go and can help shape and guide that, and who can also call you out when maybe you're not going in the right direction. So those were kind of the early things that I learned about mentorship.
Well, thank you for sharing your story first. That's an amazing and quantum leap from, one end of the spectrum to end up in the ED as a physical therapist.
Yes.
When, being an attorney was on the first part of your brain, what you thought where you're going in. But so I know you mentioned like at first you were just like, okay, here I am, lone wolf. How do I find my path? Where are these mentors? I'm just kind of taking a little bit from everyone. So how did you first connect with your mentor, and when did you find one? If you did, like what network or how did you find something that was aligned with your goals? Once you already mentioned you have to first identify what you want to do and where you're headed, or you're just kind of taking on all this excess input that might not put you on the right path. Like how did you come across that mentor, and what was most successful for you in finding that?
I think that until I was ready to kind of be honest and authentic with myself and about who I was and where I wanted to go, and to stop trying to please other people, it was really difficult for me to find a mentor that was a good match, because people were willing to help me and they were willing to guide me, but I was in so much of that headspace where I would do whatever I thought was best for my career, or saw things as a competition, or that I had to be perfect at everything all the time. And so I don't think I was ever like truly authentic with my early mentors. So it took that that moment of really being able to be happy and satisfied with who I was, and to start looking at really what was most beneficial for my life and not the life that someone else had. Because sometimes I think we look at our role models and we think, I want that. Do we want that? Or do we just see that person in their perfect life work flow and we're looking for that flow, not necessarily for that life that they have? So it took me a while to stop trying to live someone else's perfect career and perfect life, to then just realize that I could develop my own. And then when I was ready to do that, I was able to identify people who were like ready to help me push on to that next journey. So I have different mentors for different areas of my life, because that's again part of that focus on that life work flow. I need somebody who can help me say no to things. So I have a mentor and I call him my director of no-manship. And so when I'm thinking about saying yes to something because I feel like I should, I just text him and I'm like, so they asked me if I could do this thing. And then he just says, no. And I'm like, no, like, I really think I should do it. I have all these different reasons. And he'll be like, no, because if I'm asking him, he knows I don't really want to do it, even though I'm trying to talk myself into it. So that's one area where I have a mentor that serves a very specific purpose. And I'll say things like, but who else will do it? And he'll say, somebody else will do it, and kind of just reassure me so that I can let that piece of my life go. So that's out of the flow. And then I have a mentor who helps me realize that it's okay to do those big, bold things that I want to try next that are a little scary. Like when I started my new business, that was super scary. And I reached out to women in my life who had done that. I reached out to women in my life who were not successful with that. And I kind of sought mentorship from both of those areas to decide, is this what I really want? And how can they help guide me? And I think part of having mentors is getting access to that network that other people have as well. And so I look for mentors who are also in those same networks that I want to be in, that have those same beliefs that I hold that are important to me, and that really also have the time and the energy to pour into someone else, because not everybody is in that position. And then I look for mentors who really challenge me to be better. I don't want to just have mentors who will help me continue to be comfortable. And so one specific mentor that I've had over the last several years is Dr. Lisa Van Hoos, who has really challenged me to be a better human on so many different levels, and meeting her changed my life. So she's the mentor that I really want to like shine the light on today, because she challenged everything in my way of thinking about how I think about other people, how I interact in the world, and who I am as a person. And that for me was one of the most valuable mentorship relationships that I've had. Does that answer your question with a lot?
Absolutely. And that's awesome. And I'm glad that you're able to give your mentor a shout out. I think it's awesome to give people their flowers and let them know how they impact you. And one thing that you touched on that I think is important to bring up is, I think the misconception is that you have one mentor that serves multi-purpose. But would you say go as far as to say, like, seek those mentors that serve different purposes? Like, don't try to find a Swiss Army knife of a mentor. It's okay to have different mentors for different people, or like make sure it's okay. Like, you don't feel like you're limited to just one. Is that correct? Is that what I'm understanding?
I think absolutely, because when you think about it, everyone has their own perspective. And the more perspectives you have and the more mirrors you have that can help you reflect back, I think that's helpful. I also think that if you truly want that life workflow, you need people from different areas of your life. So I have mentors that are friends and moms that know nothing about physical therapy, but they know how important my home life is to me, and they mentor me in those areas. I also think another important thing to consider is that we should always have a mentor who's younger than us. And that's been a thing I find that people feel like it has to be this, I've got 15 years of experience and you only have 5. So obviously I'm the best mentor for you. I don't think that's the case. I think we all have value that we can add to one another, and that mentee-mentor relationships can also be reciprocal in that way. So one thing I've been encouraging people to do as they work on their own professional development is reach out to somebody who's younger than you, who has less experience than you, but who can guide you in another aspect of your life.
That's awesome. And that's important too, because I'm all about like lateral networking and all of that. There's someone that's on the same plane as you. We don't always have to look up. And like you said, you can look younger as someone who has just its perspective that adds value, right?
Yes.
It's not just experience. There's different things. Maybe you came from a different setting or different background that adds value to something that I haven't experienced. So I completely agree. And thank you for even bringing that up. One thing that I want to definitely ask you before we transition to the next segment is, for someone who is looking to advance their career, and because you've made a couple of pivots, like you said, you started off thinking you wanted to do one thing, and then you started in a different realm, and then you walked in the ED and said, oh, I'm home. So like, for someone who's figuring it out early in their career and wanting to advance, and what advice would you give them when it comes to finding a mentor when you are in these kind of like transitional stages, and maybe you're figuring out, what do you feel would be the best advice? Would you say hold on a mentor at that time until you figure it out? Because I know you said you had to get clear on your own goals. Or do you say just go for it and then adjust as life goes on? Or what would you tell someone who's heading in that direction?
I think one thing that I tell people, because I do a lot of professional development planning and coaching with people to help them decide, do you need coaching? Do you need mentorship? Do you need training? Like, what is your vision for your life and your career? Is that I want people to really like live a life of authenticity and intention. And in order to do that, sometimes you need somebody that can listen to you and be that committed listener. So one thing I do when I'm working with people during these sessions is I listen to them, and I ask them questions about what brings them joy, what makes them happy, where do they want to be, like what would that ideal life workflow look like, and I just write down words that come out of their mouth. So there's so many different consistent things that you can hear people when they're truly speaking into the life that they want to live into, and I just write them down, and then I give them a sticky note, and then they look at the words and they're like, oh, that's me, that's who I am. So you need that mentor who's a committed listener and who's like ready to hear and see you for who you are. And that person can be hard to find, but you can still like develop that relationship with intention and say, my intention is that the two of us work together so that I can create this life workflow that I'm looking for and that I want to live into. And I think you're the person who can really mirror that back to me and help me find my purpose, my vision, and my value.
Awesome. I agree because again, you have mentors. There are certain mentors that just want to tell and share their story and it doesn't care. It doesn't matter what your goals are. They're just like, no, I'm just going to give you all I got as a mentor. If it's not aligned with your goals, then you're just going to have to figure it out. But like you said, it's that listening piece and having someone who's committed to understanding where you want to go. And again, knowing, am I even a good fit for this? Right? Like, am I someone that can put you on the path that you're desiring to go to, or is there someone else that might be better suited for that? So I think, again, listening and understanding, but again, from the mentee side, knowing what your goals are will make sure that you don't end up taking a roundabout way to get to the end goal.
Yeah, like what is that highest yes, and how do I live that? And that person who, once they like really hear that from you and you can then sit and work with them on developing that purpose, that vision, and that direction that you want to go, then that person's there to raise you up, introduce you, connect you, guide you, and get you to that next step. And to be able to go together with somebody on that journey is so amazing.
Well, I hope that is the highlight. Going together with someone on that journey encourages all the prospective mentors out there to see the joy that comes from that mentorship. And that's a perfect lead into our next segment, which I feel would kind of almost be like a newlywed game. So we have both a mentor and mentee. Now that I think about it, we should have had them hold up cards to see if they answer the same thing about best and worst experiences. I don't know what the relationship would be like after that, but we're going into our next segment, which is the mentor mentee spotlight. So we get a 2-for-1 special. Better together, of course, because without the mentee, there is no mentor. So I'm going to let Anna take over to lead us into the mentor mentee spotlight and introduce our next guest. And thank you, Dr. Griffith.
Yeah, thank you, Dr. Griffith. I was actually typing notes as you were speaking, the nerdy side of me. But so thank you, everybody. I'm so glad we can come together and celebrate Women's History Month and with a focus on mentorship. Because mentorship is so important for furthering our career, our personal growth. So it's not just our career. It's like Dr. Griffith, she has a mentor who developed her as a person. And it's like a partnership. So something I never really thought about as a mentee was like, the mentor is actually getting something out of it. So but I had the opportunity to be Dr. Julie Boss' mentee. So we pretty much connected right away. If I had to describe our relationship, I kind of picture a lava lamp where it was like pretty like smooth and we just connected. And so we both graduated from the University of Lynchburg. And to describe Julie, I thought of a speech that our university president, Dr. Allison Morrison Shetler, mentioned about servant leadership. When you meet Julie, she's very quiet and very nice and sweet, but like in the background, she's just like doing all the work to help advocate for you and guide you. And something that we also had in common is that we both have experience in patient rehab, but she introduced me more to the acute care side of things. Like I had my very first clinical in acute care, but it had been a while. So it was very helpful to have her as my mentor. She also enjoys working with stroke patients, which is also my passion. She's also an avid runner, which I am not. All right. So Dr. Bost, how would you describe our relationship? So I mentioned the lava lamp. Do you have any thoughts?
I did not come up with an example quite that fun, but it was such a pleasure having Anna as my mentee. Like she said, we connected right away. And of course, I was super excited to have someone from my alma mater. I'm always excited to have University of Lynchburg grads and students. That's always very fun for me. But Anna was great. She came in. Um, right when we actually weren't expecting her. And so I was in no way prepared to take her on as a mentee. So I felt awful for her at the beginning because I didn't think I was prepared. But she was so sweet and so energetic and so excited to learn. And I think, like a lot of people have been saying, it's a two-way relationship with mentorship, where I know I learned a ton having Anna as my mentee, and she made it very easy in a time that I was in no way prepared to take her on at that moment.
I actually forgot about that. That's very funny. What do you think is like the most important factor in a successful mentoring relationship?
I think we mentioned this briefly. I think the biggest thing I've taken away is humility, and that is kind of a two-way street. On the mentor side, it's such a refining process to have a mentee because you realize so many things that you could be doing better. And a lot of times mentees or students come in and they're so full of life and energy, and you realize, wow, I might be not approaching this as creatively as I used to. I might be kind of getting stuck in a rut. And so it's really great to have someone with a fresh perspective and new energy and a new set of eyes, because they see things you don't and things that you've missed. And it's humbling to hear, after you leave a treatment session, why didn't you try this or why didn't you try that? It's like, I don't know. That's a great point. I should have. And so I think it was really good to recognize your own areas of weakness and areas that you can still grow. And from being a mentee in the past, I think it was always really helpful for me when my mentor would say, you know what, I was wrong about that, and realizing, oh, they're not high and mighty and know everything. So it was kind of encouraging to realize that, hey, my mentor is human too. We're all growing and we're all still learning. And then, on the mentee side of things, being able to be teachable and to be willing to learn, and to take constructive criticism as it comes. That's not an easy thing to do with with kindness and gentleness. So yeah, I think humility is a very important part of that. That I think it's easy to kind of forget. And I think a lot of times we think, oh, I'm a mentor, I know it all, I'm going to teach them the way of physical therapy. But it's so much of a dynamic relationship.
So you are in the 89% of a mentee that became a mentor.
Yes.
So something I really appreciated about you actually was your openness to express, like, if you didn't know something. And you would definitely try to find me the answers. And something I also loved was just your communication style. You're very clear, no fluff, like no like going around the answer. You're very direct with answering my questions in a way that didn't make me feel like, oh, like, why didn't I know that? Because I remember like a specific question of, I was like confused about what palliative care was, hospice care. And I was like, I think I should know this, but can you clarify? And you did a wonderful job explaining that to me. And I remember when when you didn't know that I would be your mentee, there was like some like, I don't exactly know what we're supposed to do. And then, but like from there, you gave me like a clear guideline, like, okay, so let's start with a lower caseload and we'll build your caseload over time to like when you're comfortable. And something that you also did was in one of the meetings that we had, you advocated for me to get onto different units. And I was like, oh, I didn't think of that. That's such a great idea. So that was, I was very grateful for you to be that advocate for me with things that I didn't even think of. Yeah.
I actually have a question. So we love the lava lamp. We love the cohesiveness of the mentor mentee. But what happens and I mean, if not during this wonderful relationship, aside from the running thing, when the differences, whether that was in communication style or like just thought, like, oh, I thought you should have did that. Like, what happens when it's not on the same like path? Like, so as a mentee, feeling like you want to share your perspective, but again, like there's this kind of complex when it comes to being a mentee, like, oh, like they should know more, right? And even as a mentor, like how do you communicate when you have differing views or opinions, or how do you get over that obstacle? And again, I know, Julie, you've had other mentors in the past, so Anna's great. So I mean, if it's not her in the past, when you had that kind of conflict with a mentee, how do you navigate that as a mentor and do it in a way where it's constructive and doesn't feel like you're being critical of them, to, you know, allow them to expand and grow in their career, but at the same time still wanting to get your point across and explain why this is that way?
Yeah, I think with Anna, we didn't come across a ton of problems. I have to say she might have been the easiest person in the world to be a mentor for. But, you know, definitely in the past, and, you know, occasionally when Anna and I were talking through things that she was struggling with, one thing that I realized is really important is being direct. I know in the past when I'm mentoring someone, I was so afraid of coming across as like a know-it-all, or I didn't want to hurt their feelings. I didn't want to be critical. And so I would say, oh, you know, this isn't the best. Maybe we could do it differently, but you're doing great. Don't worry. And so they came out of it not actually knowing what I was saying, and without any constructive path forward. And so I learned a lot about, you know, being direct in what I'm saying. And you can always say what you mean kindly, but no one benefits from me beating around the bush. You know, finding out how they best receive communication and knowing that early on and upfront, and then, you know, kind of meeting them where they are and saying, hey, you know, this is where we're struggling. Let's find a way forward. You know, it's not a bad thing. We're all going to struggle, but we do need to figure out how to come out of it. And I found that being very direct and to the point has eliminated a lot of hurdles, because then no one's second guessing and no one is wondering if I mean something that I didn't actually say. I think that's been the most important thing. No matter what the conflict or difficulty is just, you know, being upfront with what I mean and what I need, and then asking them, like, where are you in this? Please, you know, share your side of the thing, of everything too. It's never good if it's all one-sided. You know, direct communication on both sides makes everything easier.
Yeah, and it seems like Anna really appreciated that clear communication. Like she's like, yes, tell me exactly what you want and what you need, and we'll move forward. So for you as a mentor, like you said, like Anna came along, caught you off guard, like, oh, I have a mentee, great. So how did you balance? Because again, we in our trivia, like meeting weekly is something that's the expectation, right? So this is a whole nother addition to already, oh, I have to do my job duties, and I have this, you know, mentee in addition to that I'm trying to focus and do my. How did you balance that? And do you feel like it kind of flow seamlessly with your traditional job duties and roles, or is this something that a mentor would have to prepare themselves for and really take on seriously? Like, what's your take on being a mentor and dealing with your traditional job duties?
Yeah, it definitely helps if you have time to prepare. I think I had like 24 hours notice or 48 hours notice, um, and wasn't entirely sure how long Anna would be with us, or what really the goal was. It certainly helps if you know the expectations of your mentee and of your job, and what resources are available to you and what flexibility you have. in some situations I've had to maintain my full caseload and keep my productivity level the same. And then, luckily when I had Anna, we had a lot of flexibility. I was able to take a smaller caseload so that I could spend a lot more time with her and mentoring her and preparing her for the job duties. And so that was really great that I had that leniency, but that's not always there. And so it comes down to being very mindful of your time and being as efficient as you can be and making the most of the opportunities that come your way. So on days that were, shorter staffed and I had to pick up more of a caseload and still be a mentor to Anna, it's like, okay, we're gonna learn as much as we can while also trying to get the job done. And so it's a lot of it is just figuring out how to be as efficient as possible in both your regular work and in your mentorship role, which isn't always easy. And some days are smoother than others. And a lot of it too is being willing to be flexible of, okay, I might have some later days so that we can accomplish everything if we need to. But yeah, if you can plan ahead and if you do have some notice, that's certainly beneficial. And I normally like to kind of start at the bottom and say, okay, what do they need to know on a daily basis, on a weekly basis, on a monthly basis? How can I best kind of set the groundwork for them? Poor Anna came in without, any notice on her part, and I didn't have a lot of notice. And so it was kind of chaotic at the beginning, but I think part of being a physical therapist in acute care is you kind of know how to roll with the punches. And so that really prepared me for, okay, it's just one more thing we're going to add on and it'll work out in the end. And it did.
And then my last question really is for Anna. So after being on the mentee side of the kind of relationship, moving forward in your career, having that positive experience, what are some things that will kind of push you to be a mentor for someone? Or do you feel like, from what you've seen from her side, does that discourage you? Do you feel like this is something I want to do because I benefited from it? Like, what's your take on it, with this being such a positive mentor-mentee relationship and experience?
Honestly, there were times where I wish I had my phone on me at all times so I could record exactly how she said things. So I could explain that to a future mentee. Yeah, so no, it definitely motivates me to be a mentor for somebody. And from like actually just like putting this presentation together, I would self-reflect on like, okay, like mentors get a lot out of it. Like they themselves grow by being able to explain things and actually question their own thought processes when they're treating a patient, and kind of identifying their strengths and weaknesses and things like that, so like the learning process never ends. So like this relationship kind of highlights that yeah, the learning never ends, but like you can learn, like Dr. Griffiths was saying, like learn from people who are younger than you or don't have as much experience as you. So it also kind of ties into what Julie was saying about humility, I think. But yeah, it's been a fun experience.
So safe to say you will probably be contributing to the 89% of the mentees that become mentors. Is that the percentage? All right, we'll be looking forward to that then, Anna. Well, thank you both. I'm glad this was such a like rosy experience. I love that. I've heard horror stories. I'm glad that this wasn't that. I'm glad that you all were able to navigate everything, even with 3 seconds before knowing Anna was going to be your mentee. You hit the ground running and took on your caseload and still came out on top of things. So that's awesome. And thank you both. All right. And so I think what we're going to go into now is really wrapping things up in the closing, we've heard some amazing stories. We've heard the power of mentorship from both the mentee side and the mentor side of things, like how mentorship is not one dimensional. If you need 10 mentors for every facet of you, then go ahead and find that, but make sure it's aligned with your goals, so you're not just collecting things along the way and wasting people's time. As we've seen, you want to be mindful of others' times. Being a mentor does take time. Like Julie said, you have to put aside the time, you have to plan for it and understand. And then, like Anna said, you have to be able to participate fully and take in what they're telling you and use that as not just immediately, but moving forward in the future. So maybe that's something that you can share with someone else. And when it comes to resources, on the next slide, we were able to gather a couple of resources for both mentors and mentees. We created our own document that we have PDF access to that can be found online, that we collected everything with, but the APTA actually has best practices in mentorship for physical therapy available. We'll have that within the document. It has really everything that we touched on in terms of goal setting. Find someone that's aligned for you, making sure that you're checking in regularly, and just look at that, review it, see if that's something that you're willing to take on and do. Highly encourage it, especially like we said, all the benefits of being a mentor when it comes to the profession, specifically highlighting women in Women's History Month. Our profession, there are these disparities and we're trying to close the gap. So if mentorship is the way to do that, then let's go ahead and move forward full force with that. Anna's been converted. I've had great mentors along the way and everyone else. Let's all, and then again, Victor on the call, like we all, I think last year during the panel, we talked about the importance of mentorship from everyone, right? Like I've had male mentors, and I think even Dr. Griffith spoke on some mentors in her life. Like, don't assume that, oh, as a woman, I need a woman mentor, because if it's someone that isn't aligned with you, don't feel like you have to join on board just because of that. Like, and again, as a male, you can mentor someone else, lift them up. We've already seen the statistics. It's more men in those director and leadership positions right now. So if you feel like you can reach down and pull up to make things more equitable and to really balance out the profession, then definitely do so. I think if anyone has any questions, is that what's next on our agenda? Oh, volunteering. Yeah, Lynette. Any questions for either of the presenters, you can put them in the chat at this time, and then Lynette's going to bring everyone on board and tell them why they should join our committee in assisting with the D&I in Virginia.
Well, we could always use help on our committees. So we are the Cultural Humility team, and we put forth some education opportunities like this. And so they're fun to work with. So if you would love to join the Cultural Humility team, that would be great. But there are also other committees, content production, and there's community outreach group, like we mentioned before. So if you're interested in volunteering, we were going to put it in the chat, but this is recorded, so that might not work as well. If you're interested, though, please contact us and we will send you an email with all of the forms to fill out if you're interested, and then your information so that we can get back to you, and you can choose which committee you might be interested in. We would love to have you join us. So thank you so much in advance for your participation and joining us in your service. But we do want to answer questions. If anybody on the call has on our meeting right now has questions, we'd be happy to answer questions. So please just email us if you do have questions for us regarding this. I will personally say that I've had a few mentors, and it is, I think what comes up to me is when I had a mentor assigned to me at the hospital that I'm at now, and they said to me, I felt so bad because I have 20 plus years of experience, which was more than the clinician that I was working with. And he said to me, "What am I supposed to do?" And I said, "I have a lot to learn from you, just so you know." So it was a very fun relationship, I feel like, because he didn't really know what he was going to teach me. And I said, "You have a lot you can teach me." So I think it is very true to go both directions, both older, younger, equal, all around. You never know where you're going to find that great mentor. So just keep your mind open to all of the possibilities and availabilities, but you need to know yourself, like Dr. Griffith said, know yourself so that you know who to seek out and the person you need at that time. But yes, I don't know if anyone has any questions.
I have a quick question for Dr. Griffith.
Sure.
Have you ever reached out to somebody and asked them to be your mentor? And if so, how did you go about that?
Oh, I mean, you just ask. I think most people, I think another issue that we have in physical therapy and other professions as well is that like little bit of feeling of imposter syndrome. And I think that goes both ways in this type of situation where you're like, I don't deserve to be asking this person to be my mentor. And then that person that you're asking is probably going to be like, what? She wants me to be her mentor? So I think it's good to just ask. I mean, I've had people, where I've reached out and they've said, hey, I'm like really supportive of what you want to do, but like I can't provide that for you at this time, and that's fine. And then other times I've reached out and people have maybe not seen themselves as mentors, and me like inviting them to be one, help them see themselves in that light, and then we had a great relationship. And then most of the time people will just say yes. What are you looking to get out of this relationship? How can I best contribute to you? And so I would just encourage you to ask. People can't say yes unless you ask them. So I think you should just ask.
Thank you.
I would like to just share a couple of things, if that's okay. So in one of my roles as chief delegate of Colorado, one of the things we talked about in a survey was actually pay equity, right? So one of the motions that Colorado will be bringing to the House of Delegates this year is about gender pay equity. And that's across the entire gender spectrum, not just men versus women, but the entire gender spectrum, to ensure that we are compensating physical therapists fairly and equitably, not necessarily equally, but equitably throughout the gender spectrum. So I would just encourage you, if that is of meaning and value to you, to contact your delegates in whatever state you might be in, and just let them know your thoughts about that and get involved in the process. And then the other thing that stood out to me in the survey was this concept of that there are so many physical therapists who are women and not very many in leadership roles. And one thing I often say to people is that leadership is an action and not a position. But that being said, like women, like let's get our foot in the door and let's get on these committees. Let's start leading in these areas. And if you have any like questions about how to get involved and how to actually have that action and that position, I'd be happy to connect you with people who are ready to see you lead, because I bet there's more people than you think that think you should be in those leadership positions. So I would just want to invite you to consider that you probably already are a leader and that we need you and we need your expertise and we need to keep moving forward together. So I'm just going to challenge you to think, what area do you want to be a leader in this profession? And then the last thing is, I just want to acknowledge all of you who are on this committee for the work that you're doing. I know that sometimes it's not popular work and it's always hard work. And I really just want to thank you for your time, your effort, and your sacrifice that it takes to do these things. And I appreciate your contribution to our profession.
Well, I thank you for joining us today. I really do. You brought some great insight. And I really do think I might have met you at some point in Colorado. I kept looking at your picture. I'm like, no.
Well, you should just come back, like, welcome back.
But thank you. I don't know, Blake, did you have anything else?
No, I think, that was a high note to end on. So I think that, like, if anyone has questions, please reach out to us via our social channels or our email address if there's any questions or about involvement or anything. If our guests will be open to sharing their email addresses for anyone to reach out so that they can contact them if they have direct questions or are seeking mentorship. We'd love that, and we can always discuss that later too. But I think this was amazing. Thank you everyone who's attending, especially huge thank you to our participants. The work you're doing is monumental, and this event isn't enough to thank you for everything that you're doing. And please continue to have your mentees and have those great experiences so that you can continue to add. And maybe in the next 10, 15, 20 years, that percentage from mentees that transition to mentors is above the 95% threshold. We're trying to get everyone in there. We're trying to make that flip of women in leadership roles and those higher level positions. But thank you to everyone who's been here. Again, this is ABTA Virginia, the Diversity and Inclusion Committee, and the Cultural Humility team is the one that hosted this event specifically. But please volunteer your time, your efforts, your energy, everything. And I think that's a great event, everyone.